Definition and classification of scoliosis. What is scoliosis? The Scoliosis Research Society defines scoliosis as an abnormal lateral curvature of spine with a Cobb angle of 10 degree or more. Scoliosis is usually a three-dimensional deformity involving deformity in the coronal plane, sagittal plane, and vertebral rotation. Now let us see how do we measure the Cobb angle. Cobb angle is the angle between a line drawn along the superior end plate of the upper end vertebra and the inferior end plate of the lower end vertebra. So what are these end vertebra? End vertebra is defined as the most tilted vertebra towards the concavity of the curve. So in the curve we have two vertebra on either side which are most tilted towards the concavity of the curve. The upper one is known as the upper end vertebra and the lower one is known as the lower end vertebra. There is another term called as the apex or apical vertebra. It is the most laterally displaced vertebra from the midline. So if this is the midline, this vertebra is the most laterally displaced vertebra and this is known as the apical vertebra. Now to make the Cobb's angle, we draw a line along the superior end plate of the superior end vertebra and along the inferior end plate of the inferior end vertebra. The angle between these two is the Cobb's angle. Now sometimes when this angle is very less, these lines may meet far away and often outside the X-ray plate. This creates a problem in measurement. To circumvent this problem, we draw two perpendicular lines and the angle between these two lines, that is this angle, is the Cobb's angle. Now scoliosis can be present in the pediatric population known as the pediatric scoliosis or in the adult population known as the adult scoliosis. Pediatric scoliosis is classified into congenital scoliosis, idiopathic scoliosis, neuromuscular scoliosis, and other types. In a congenital scoliosis, there is a vertebral anomaly present at birth, and it is further subdivided into failure of formation and failure of segmentation and a mixed type. In idiopathic scoliosis, it is not associated with a vertebral anomaly, and there is no other known cause of scoliosis. It is the most common type. Further divided into infantile type when the child is less than 3 years of age, juvenile between 4 to 10 years of age, and adolescent greater than 10 years of age. Neuromuscular scoliosis is either due to neuropathic causes like cerebral palsy, poliomyelitis, and spinocerebellar degeneration, or myopathic causes like muscular dystrophy. Other types include developmental scoliosis in conditions like skeletal dysplasia or skeletal dysostosis. There is also tumor-associated scoliosis in bony tumors like osteoblastoma and osteoblastoma, or soft tissue tumors like neurofibroma and astrocytoma. Adult scoliosis can be divided as idiopathic or residual scoliosis or scoliosis which has developed de novo. A idiopathic or residual scoliosis is a progression of adolescent idiopathic scoliosis. This has classic curve patterns as seen in the adolescent idiopathic scoliosis. More segments are usually involved, and it involves both thoracic and lumbar segments, with more commonly seen in thoracic segments, and the curve magnitude is larger. A de novo scoliosis develops in the adulthood and is usually due to degenerative condition. There are no classic curve patterns in de novo scoliosis. Less segments are involved. It usually involves the lumbar segments as degeneration is more common in these segments, and the scoliosis is of a smaller curve magnitude than the idiopathic scoliosis. Scoliosis can also be divided into structural scoliosis and non-structural scoliosis. Structural scoliosis is associated with a structural spinal abnormality and is associated with vertebral rotation. So in structural scoliosis, there is vertebral rotation along with the coronal plane deformity. This usually does not correct with postural changes. Non-structural scoliosis is also known as functional scoliosis. It is not associated with vertebral rotation. Common causes include muscle spasm and limb length discrepancy. It usually corrects with postural changes. The test used to distinguish these two is the Adams forward bending test, in which the patient is asked to bend forward. In a structural scoliosis, due to the vertebral rotation, the deformity or the rib hump becomes more prominent on forward bending, and in a functional scoliosis, this usually disappears with a forward bending. So this is how we can distinguish between structural scoliosis and non-structural scoliosis. So friends, this was a discussion on the definition and classification of scoliosis. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.